What's up guys, my name is Omar and this video is part 2 of the opioid series. Now today I'm going to cover the signs and symptoms of an opioid overdose and what you should do if you suspect somebody is having an opioid overdose. And just as a reminder, when I talk about opioids, this applies to heroin, opioid painkillers, fentanyl, lean, scissor, purple drink, whatever you want to call it. It applies to all of those. They're all opioids and they all have very similar, if not the same effects on your body when you overdose on them. So if you remember from part 1, some of the side effects of opioids are respiratory depression and sedation. Now, when somebody is overdosing on opioids, you may notice that that person is unresponsive to your touch or unresponsive to your voice. It's possible that they may be awake but unable to speak. Their breathing may be very shallow or irregular. Their heartbeat may be slow, it may be irregular, it may stop completely. Their fingernails and their lips may turn like blue or purple. And for darker skinned people, their lips may turn like grayish and start to ash. Now, if the person's eyes are still open, you may notice that their pupils are pinpoint and they start to constrict. Also, a lot of times when people are overdosing, they may look like they're sleeping, but while they're sleeping, they're making very irregular sounds or very irregular breathing sounds. It may sound like snoring or gurgling, but that person may actually be overdosing. Now, if you suspect somebody is having an overdose, there are a few things that you can do that may save that person's life. So, according to harmreduction.org, and I'll put the link down in the description for that website, but according to harmreduction.org, the first thing that you should do if you suspect somebody is having an overdose is to assess the person. Is the person responsive? Shout their name, shake them, see if they're responsive to your voice. Can they speak? Is the person breathing? Are their lips or fingernails changing color? If they're displaying any of these signs of overdose, it's time to try to stimulate them. If they're unconscious or they're nodding off, try to shout their name. If the person is still non-responsive, take your knuckles and rub them across the person's sternum like this, and that should stimulate them to wake up. If you don't have access to their sternum, take your knuckles and rub them across their upper lip. And if the person wakes up from stimulation, check their breathing. Check to see if they're able to speak. And if they have shortness of breath, their breathing is shallow, or they have chest tightness, you need to call 911. And when you call 911, make sure that you stay with them and continue to keep them awake by stimulating them. Now, if the person does not respond to any of the stimulation, the sternal rub, rubbing the top of their lip with your knuckles, it's definitely the time to call 911. And if you have Narcan or naloxone handy, now is the time to use it. Narcan or naloxone is an opioid antidote. So it's an opioid antagonist and you can give it either intramuscularly or intranasally, and it can, in a sense, reverse the effects of the opioids on a person, but only temporarily. There's a lot that goes on with Narcan, so I'm actually gonna dedicate the whole next video to Narcan, but if you have Narcan available, now's the time to use it. And if you don't have Narcan or you gave Narcan and the doses don't seem to be effective on the person, now is the time to start giving rescue breaths. This can be done by laying the person on their back, lifting their chin up, opening up their airway and examining their airway. Make sure that there's nothing inside of their mouth or obstructing their airway. If there is, pull it out. Pinch their nose and form a seal over their mouth with your mouth and give 2 breaths. You should be giving enough air so that out the corner of your eye you should see their chest actually rise. And the aim should be 1 breath for every 5 seconds. But back to 911. When you call 911, make sure that you explain to them that the person's breathing has either slowed or stopped. Explain to them that the person is unresponsive and explain to them your exact location so they don't have a problem finding you. And try to stay away from phrases like drug overdose when you're talking to the 911 dispatcher. Unfortunately, some people have a bias, and that may mean that your call may not be put as a priority. And while you're waiting for the paramedics, like I said before, it's very important to stay with the person, constantly try to keep them alert, constantly try to stimulate them and wake them. Now, I know I mentioned a bunch of things to do during an opioid overdose because there's a lot of things that are necessary to be done. When you got call 911, Narcan, rescue breaths, the most important thing about this is time and efficiency. if there are a bunch of you there, it's really important to split the duties up. One person should be calling 911, one person should be administering Narcan, one person can be giving rescue breaths. It's important to divvy up all these duties because they essentially all should be done at the same time. The time is of the essence, and this person will die if you don't get the necessary help to them, if they don't get Narcan in time, if they don't get rescue breaths in time, if the paramedics don't come and get them to the proper facility in time. All these things play a huge part in whether or not this person is going to survive this overdose. And if you're alone, if it's just you and the person, and you have to leave the person even for a minute to grab a phone, Narcan, whatever it is, make sure you turn the person on their side. Make sure their face is turned to the side, and make sure that their body is being supported by the outer knee so that this person doesn't choke if they so happen to vomit. Now, oftentimes people don't call 911 because they're afraid of being charged with the crime. Especially if they were partaking in the drugs or they're the supplier of the drugs. But actually in some places, there's laws that protect you from being charged with anything if you call to save somebody's life. But if you're still not comfortable calling 911, doing something is better than doing nothing. Have someone else call. Pull a bystander off the street, have them call. Use somebody else's phone. Bring the person to some place where they can be found so someone else can call. Do something. Doing something is better than doing nothing and letting somebody die. I appreciate you watching. For more videos like this and videos that tackle issues around mental health, like my YouTube page or subscribe to my YouTube page and like my Facebook page. I try to get videos and articles and stuff up there on a regular basis. Until next time, later guys.